Tonight on Children's Hospital.
Thank you, mister.
7-year-old Jack faces his 22nd operation.
I want to run faster.
Can I have a look up your nose?
Will doctors manage to get an orange pip out of 3-year-old George's nose?
Oh, we can see it.
And 5-year-old Jake's had a nasty bump to the head.
No.
Better.
Oh, is that better now?
The brand new Royal Manchester Children's Hospital is one of the biggest hospitals of its kind in Europe. All specialist services are now under one roof in a space equivalent to 39 football pitches. Its dedicated medical team of 1,000 work round the clock, transforming the lives of the children who need it most.
This is Manchester Hospital. This is my hospital.
For children like 7-year-old Jack Norfolk, the Children's Hospital is a second home.
Barge through the doors. Uh-oh, someone's coming. Oh, I nearly had it then.
Since birth, Jack's had a long list of genetic health problems, from bone disease to kidney failure. He's always been seriously ill, but he tries not to let it get him down.
I'm really, really proud of him. He's been through so much in the 7 years.
Can I do this bit? I love it.
I think he's an inspiration to other people.
Okay. Oh, that wasn't very good steering, was it?
Jack has lost all that sense of fear and most of the respect for doctors and nurses, and just treats us, as he should do, I suppose, like ordinary human beings that he could enjoy his childhood with.
Ground floor. Oh, ground floor.
He keeps me going. He really does.
Jack Norfolk going.
Bye-bye, Jack.
There are lots of patients with complicated conditions, but there aren't that many Jacks.
I'm doing my blood pressure.
Today, Jack's having treatment for his most serious condition.
Lift your shirt up for me.
His kidneys were removed when he was 4, so he needs to have his blood cleaned during dialysis 3 times every week.
These lines, there's the lines, it plugged in to me here, so it goes all the way down there and it plugs into the machine. Yeah, crikey, isn't it?
Like all the children waiting for a kidney transplant on Ward 76, Jack can find the 4-hour treatment hard to bear.
I don't want to have it anymore. I just want to be a normal life and just eat bananas and stuff.
Along with hundreds of children around the country, Jack's wait for a new kidney could take years.
Take a card.
Do I have to look at it?
Nope.
But unlike the others, Jack needs treatment for lots of health problems. Tomorrow he'll have a major operation to repair his hip. It's been damaged by disease, preventing him from walking properly.
The hip bone, it's like a ball socket that's broken. So they've got to fix it. It's for my own good.
Consultant Malcolm Lewis has over 20 years' experience treating children with kidney problems. He's known Jack for years and understands how hard treatment can be for him.
What's with all the hiding today? He usually comes out, hits me, does all sorts of things. Completely wild most of the time. It's a very unusual day for Jack. He's probably fairly fed up with hospitalisation and all the intervention that he's had to have. If you think about the dread that people get in their system when they think that they have to go to theatre, then just think how Jack feels.
He'll be fine. He'll bounce back, he always does. He'll be chatting on the ward tomorrow.
In the morning, Jack will have an operation, which should make his life a little bit better. The Children's Hospital has its own accident and emergency department, run by a dedicated team of 60. Alex Blythe's been a doctor for 12 years He's a newcomer to A&E and is getting used to some unique challenges, like 3-year-old Georgia. She's been playing with her food and put an orange pip up her nose.
I put the pip on my finger, then I put it back here.
Georgia, nice to meet you. Have you got something up your nose?
Yeah.
Have you?
A&E staff spend a surprising amount of time taking strange things out of noses and ears.
What's he going to do?
There's nothing that parents have done wrong, it's just kids do that sort of thing all the time. If it got sniffed into the lungs, it could cause problems with long-term infection, and I suppose the ultimate nightmare scenario is if it actually blocks and prevents them from breathing.
We'll get that silly pip out, won't we?
If it's stuck, the only way to get rid of it without hurting is to give them a general anaesthetic and take it out in theatre, and if we can avoid that, that's marvellous. Can I have a look up your nose? Which side was it that the pip went? Definitely that side.
It's...
Do you have any idea?
No, it is that one.
definitely.
Yeah, it's that
Can
one.
we
Sorry.
have a look? Oh, it's hard and round, which means that the little crocodile clips we've got here are likely to push it in rather than pull
Well,
it out.
that's why I didn't try it at home.
That's perfectly sensible. Because she's so small, if it was you or I would ask you to try and blow it out. She
Yeah,
won't.
we've tried and she can't.
No. But what we can do is if we lie her down
Yeah.
and you gently block the nostril where the pip isn't,
Yeah.
and you forcefully blow into her mouth, it may well be possible for you to blow it out. Can we lie you down? 1, 2, 3, 9, 12, 14. Hey. Can I help you, Mum? Can I just press on your nose like that? Let's give it a go.
Open your mouth a wee bit. 1, 2, 3.
There we go, it's out. All done.
Hey! Clever girl! Look at that! Did we do well?
It's all gone now.
Well, I learnt a new little trick today. Hopefully I won't need to use it again.
That was good fun. It's always nice to be able to avoid an operation.
Bye-bye.
The advice is don't try this at home, but come into hospital, we'll get things sorted out here and we've got extra help if we need it.
Mama.
7-year-old Jack Norfolk's arrived to have his hip operation, but he's dreading it.
I think he's very anxious about this one. Even though his legs hurt, I think he thinks this operation's not a necessity, really.
Jack will have a general anaesthetic for the 3-hour operation. He's had 21 over the years, but it doesn't get any easier.
How are you?
All right.
You feeling okay?
I just don't want to go.
Is there anything in particular that's worrying you, though?
I don't want you to chop the bone off or anything.
No?
I just want to go home. I just feel like creeping out the hospital. So I'll be creeping like this. Jack, get back to your ward, you're not creeping out here. Then I go again. You're not going out here, get back to your room.
Can I have a little look at your leggies?
Surgeon Andrew Henry has over 20 years' experience operating on children, but he's rarely carried out this procedure on someone as small as Jack.
I don't want it on the finger to all right.
Yeah. The thing is, we need to try to do it to get... Maybe it's okay now, but as from stopping it from it getting worse. Do you know which is the one we're doing?
This one.
Okay.
Disease has flattened Jack's hip bone, and it needs to be pinned and supported so he can walk without pain.
The hip joint now looks like a bit like a rolling pin. It's not round all the way round. It's round in one position and flat in the other one, so they tend to have a very fixed range of motion. But one of the main things is to contain it and stop it from flattening out even more. Let's do a little mark. It's an arrow, look.
Oh, blue.
Ish.
There you go.
Okay.
There you go.
Okay.
No, don't wet it. It's all right.
We need to do the consent, yeah?
Look.
It's a major procedure for anyone, but Jack's other health problems mean he's particularly vulnerable to complications.
The left hip, it might get infected. You might have a hematoma, that's blood clots. It might bleed more than expected. as you're cutting the bone, you might get a non-union. That means that the bone doesn't unite. A DVT, you know what it is, it's a deep vein thrombosis.
Okay.
I know it's a list as long as my arm, but it's just I need to tell them to you. Okay?
Thank you.
And if you want to sign that there.
Although there are risks, Jenny and Jack know a successful operation will mean he won't have to depend on a wheelchair to get around.
To be honest, this operation I'm quite wary of. Yeah, it's something completely different to any of the other operations Jack's had in the past.
With around 400 children passing through its doors every day, the new Royal Manchester Children's Hospital is now the largest hospital for kids in the UK. The hospital's A&E department treats children up to the age of 16, 24 hours a day, 7 days a week. 5-year-old Jake has just arrived. He's banged his head, but he's not sure what on.
I didn't see how I got hurt.
But you fell down the stairs,
Yeah.
didn't you?
On the top stair of the slips.
Looking after Jake is Dr. Lorcan Duan, who's been a consultant in emergency medicine for 13 years.
Oh, I see. Okie dokie. That's deep and it's going to need stitches, so right.
Yeah.
With children as little as Jake, stitches can be too painful. Dr. Duan is going to try a gel to numb Jake's wound. If it's too painful, he'll go to theatre.
We'll have to make sure that you're better, all right? Putting something onto an open wound is painful, but if they tolerate that quite well, that's a good sign that they will tolerate the rest of the procedure. And also avoiding it as general anaesthetic.
Good boy, Jake.
I can't even... Ow, it's hurting!
Is it?
Oh, sweetheart.
All right.
Good boy, though, Jake. You're keeping your head nice and still. I'm right here, sweetheart. This is the only bit that's going to hurt, sweetheart.
Ouch!
Now,
Oh, is that better now? That was
can you
quick.
put your head up like that for me?
Oh, you're so brave.
Keep
sweetheart.
still there.
Jake's being very brave.
I'm going to give you some special gas as well.
Dr. Duan is going to give gas and air to help Jake relax enough to be stitched.
Hey, I think it's the same as, you know, when you get a balloon and it makes the balloon go up in the air. I think it might be that kind of gas.
Am I going to go up in the air?
That would be funny, I hope not. When women have babies, they sometimes breathe this to make them feel better.
Well, did you?
No, I didn't like it.
Oh. You haven't, but you didn't like it.
If the gel, the gas and Mum's hand-holding have done their job, then Jake won't notice the needle and he won't need a general anaesthetic.
Just breathe normally, sweetheart.
Might be a little scratch, like, have you been scratched by a cat?
No.
Is it okay?
Yeah.
It's okay. It's better now, Mummy. Oh. Well done, Buster. You did really, really well.
After 6 painless stitches and then a packet of Maltesers, Jake is cleaned up and ready to go.
Now you've decided you like the hospital, don't you?
I like
But he wants to come back.
I like this hospital.
You like this hospital? Oh, good, I'm glad. Say bye-bye.
Mummy.
All right, you're all right.
7-year-old Jack Norfolk is about to have hip surgery, which could mean he'll be able to walk without constant pain.
Every time he goes to the theatre, he reacts the same. He always tries to get out of it. Bless.
It will be Jack's 22nd general anaesthetic.
Every anaesthetic is a risk. You want to take him off the table and say, no, I'll take him back.
During the operation, Surgeon Andrew Henry will break Jack's hip bone and twist the ball so it fits more comfortably back into its socket, but there are possible complications.
With specific to this is as you're cutting the bone, you're creating an artificial fracture, is that the fracture might not unite, or it might slip before it unites, and then it unites in the position that you didn't want it to. Yeah, can X-ray come in? Okay, shoot.
The team use X-rays to make sure they break and reset the hip bone in exactly the right position.
Give me a 37 screw.
Just really nervous for him. You just wish you were in their place.
Shoot there. Oh, yeah, it is moving.
It's the waiting as well, it drives you mad.
I just put the big screw into the head, and I've displaced the bone, and I put the plate on, and we need to put 4 screws in, and then it's done.
After nearly 3 hours, the operation is over. Jack will go to a recovery room while Mr. Henry heads to the ward with the news Jack's mum's been waiting for.
It went well, and the good thing is that his bone actually was stronger than I thought. So the screws have a really good hold on the bone.
I just want to go and see him now.
Jack will spend the next few days on the high dependency unit.
Yeah, bud.
When the wound has healed, it'll be time to see if the bones have aligned in the right position and he's able to walk again. Downstairs in A&E, 14-year-old Mohammed's done his leg in playing hockey.
Right, my friend, might be a little bit sore, but let's have a quick peek.
Looking after him is Professor Simon Carley. With years of experience as a doctor and a surgeon, Mohammed's in good hands.
Okay, well, that's disgusting. Do you look at it?
No, I don't really want to look at it, son. That father thing, doesn't like seeing his son.
You'd think that this part of your body would be really, really good at healing, but it's not. It's absolutely rubbish. The blood supply down here is not good at all, and these things don't heal very well. I'm going to give it a good clean and have a look at exactly what's going on. If this is too sore, let me know, yeah?
It's very painful.
Do you want to squeeze my hand?
I might break it. Ooh.
Mohammed's going to need stitches, so Professor Carley offers him some pain relief.
Okay, what I can do is put a little bit of local anaesthetic in around that, which would require us to put a little needle in.
Inject my leg? You don't go in, I ain't having no needle in my leg.
Are you sure?
Watching somebody put a needle through my leg, you're there smiling and you're scared out your life.
A numbing gel has already been applied to the wound, which should ease the pain of the needle.
But you won't feel it because that bit's numb.
Do you want to give it a try?
I'll try.
Amen. Right, I'm going to get the kit.
Don't look.
A little sharp scratch. If it gets too sore, you let me know, yeah? So that's the whisper, isn't it? Okay.
There you go.
Marks out of 10.
Don't feel anything. Just very surprised. I thought it was going to hurt.
With the wound nice and numb, a couple of stitches and the job's done.
If you approach a child with a needle, you don't have to be very old to realise that things are going to get painful. So I think if we can explain to them what's going on and understand that they have concerns, which, let's face it, are the same concerns that you or I would have, and try and work with them to do the right thing.
See you later.
Cheers. Have a good day. Thanks very much. You're welcome.
See you, Mr. Haddon.
Take care.
Okay, hello from me.
I am feeling strong.
Right, lean up a little bit.
I'm ready and waiting.
It's been 5 days since Jack's hip operation, and he's about to try walking for the first time.
Get you up. Sorry, babe, it's moving slow.
It'll take a lot of physio treatment, but it's essential he starts to get upright.
Hold on. Have you got it?
Yeah. It feels like hard on my feet to be on the floor and a bit wobbly on the first. I feel shaky. Like when you push it forwards, you that then push it, it's a bit sore.
Take a while, but he's brave getting out of bed this quick. Getting out, aren't you? Glad he's back on his feet.
So now I can get up and do
tippy toes.
What I can do. Ouch. Hey!
Hey, look at you walking.
Get your tippy toes.
Jack's still waiting for a kidney transplant, but thanks to the operation, he should at least be able to walk more comfortably in the future.
Push that one. Nice and straight. Oh, you're doing really good. Oh, okay.
It's hard work, innit?
Tired.
You're having a rest.
It's another step to get Jack on the right track, really. That's what he's used to. He's used to coming in. He's used to having things done. But to him, he's just Jack. He's no different from anyone else. He's just Jack and he just gets on with it.
Don't put your full weight on.
I wouldn't have him any other way, I don't think.
I'm getting out of this plane.
We'll be catching up with Jack later on in the series.